The thigh bone's connected to the knee bone's connected to the shin bone's connected to the... Oh, hi there. I'm Dr. Alyssa Shepherd, holistic pregnancy and birth coach and creator of the course Belly Bliss, the art and science of bonding with baby before birth. And today, what's got me singing is the topic of bones, as I'm going to take you on an empowering tour of the bones of your pelvis. Now, anatomy can be super dry and boring. Believe me, as a chiropractor who studied a lot of anatomy in school, I know. But when anatomy is relevant to your life and you're not worried about a bell ringer exam at the end, it can actually be pretty fun and super empowering to have a better understanding of your body. I also want this tour to be interactive because you'll learn better if you actually touch these bones on yourself than if you just watch the video and listen to me talk. So to start, I'm going to ask you to put your hands on your hips. Now, you're not actually putting your hands on your hips because your actual hips and your hip joints are super deep inside your pelvis, far too deep for you to touch. Rather, when you put your hands on your hips, you're putting your hands on the tops of two bones called your ilia. These two bones right here. For some people, the area between the top of the ilia and the pregnant belly can be a spot of nerve compression in pregnancy, leading to aching, tingling, numbness, or some other not so nice sensation in your outer thigh. Now, if we follow these bones, the ilia, backwards, we come to the buttons or dimples of the low back. These are your sacroiliac joints, or your SI joints for short. Their name comes from the two joints involved at the joint, the ilia, which you've been touching, and your sacrum. Now, your sacrum is the triangular shaped bone in your pelvis right in the middle here. And it's a super important bone inside pregnancy for a number of different reasons. One of which is that it's in intimate proximity to baby and the uterus. And it's super easy for misalignment and tension to occur in the sacrum during the changes of pregnancy. Increased relaxin, shifts in gravitational lines of your body, and changes in biomechanics as baby grows. But it's also super important because there's a ligament that connects the sacrum directly to the uterus, meaning what the sacrum does, the uterus feels. You know all those stories about someone who's pregnant and they go see a chiropractor with a breech baby, they get adjusted, and then magically the baby flips head down? Well, what the chiropractor did was to adjust the sacrum, shifting mechanics and tensions in the pelvis, helping allow baby to do what baby knows how to do, turn head down. Pretty cool, right? Now, if you walk your hands down your sacrum, you come all the way to the bottom to your coccyx, or your tailbone. Now, one thing that I forgot to mention about the sacrum is that it's super important for birth. It needs to rock forward and backward, just like this. When it rocks this way, you can see how the tailbone dips into the birth canal, right? This is why it's less optimal to birth lying flat on your back. You increase the risk of injury to your tailbone. And believe me, you will care after you give birth if it hurts to sit. Okay, so let's come back to the ilia now. And instead of moving backward, we're going to move our hands forward and down, right to almost the very bottom of your pelvis in the center, just above your genitals. This is your pubic symphysis. Now, where some joints like your knees like to move a lot, the pubic symphysis doesn't. It really doesn't like motion. When there's motion there, it tends to get a bit angry, and then you get what people call lightning crotch, or symphysis pubis dysfunction. But lightning crotch pretty much says it all. It's not fun, although it's something you can manage and alleviate so that you're not in constant pain. Next to your pubic symphysis are your two pubic bones, which you may feel as tiny bony bumps just to the right and left of the midline, next to the joint. This is where your inner thigh muscles attach. I'll talk about these as well as symphysis pubis dysfunction a bit more in another video. But for now, that concludes our tour of the bones of your pelvis. And that wasn't so bad, right? Honestly, I hope it was actually kind of fun and informative. All that having been said, if you found this helpful, be sure to click the subscribe button so you can catch all the awesomeness to come. And if you know someone who might find this helpful, please share it with them. We are all stronger together, right? And for more information on my online course for holistic birth prep, birth bliss, or my belly bliss course, check the notes below this video. Thank you so much for watching. Bye. Bye for now.